Weekends, Albertans learned of a horrific case of abuse in a private seniors facility. A woman suffering from severe bed sores was left without proper care and developed life-threatening infections. Alberta seniors will continue to suffer this sort of abuse and more often until this PC government takes real action to solve the crisis in long-term care, legislating staff-patient ratios and delivering services publicly, which report after report and good old common sense shows is the best way. To the Minister, what's the point of your seniors advocate if the office is not independent and the system is thoroughly gutted?
Honourable Minister.
Well, Mr. Speaker, one thing that we will know will not work is focusing this debate on ideology, particularly that most deeply held by this honourable member and others who have stood up time after time to talk about quality issues in the context of their personal beliefs. Mr. Speaker, what will allow us to continue to improve the very high level of care that's already provided in the province is a focus on quality, a focus on measuring and monitoring adherence to quality standards, improving those standards as we go forward, and supporting frontline workers to deliver on that quality.
Honourable member.
Well, it's interesting on standards because the president of the Canadian Federation of Nurses Unions said this morning that Alberta has the lowest amount of nursing care in our long-term care facilities of anywhere in Canada. And given that the recent report from the Parkland Institute shows as well that residents in private facilities on average get an hour less of care, will the minister admit that his government's obsession with private care, which is ideological anyway, is shortchanging our seniors, endangering their health and depriving them of the dignity that they deserve?
Well, Mr. Speaker, the people of Alberta are indeed fortunate that this honourable member is not making decisions about how to meet the growing needs of Albertans with respect to seniors' care and with respect to health care generally. This is a province that's growing by the size of the city of Red Deer a year, Mr. Speaker. The answer to this is to support frontline workers with the tools and the resources that they need in order to do their job. Ideology has no place in this debate, Mr. Speaker.
Honourable member.
Well, you know that the Alberta NDP has tabled thousands of working short forms of long-term care staff showing the residents were left in bed, missing baths, and weren't responded to in a timely manner because of inadequate staffing from this PC government, and given that caring for our seniors really should be the first priority, I would say, and most Albertans would say, will this minister please commit to legislating staff ratios for long-term care in this province to ensure that our seniors deserve the care that they deserve and not just empty words?
Mr. Speaker, what this government will commit to and what we have continued to deliver on is to provide Albertans with access to the services that they need. And that's based on a personal assessment, Mr. Speaker, a professional assessment of the residents' needs and the patient's need. It is not based on legislated ratios. It is not based on ideology. It is not based on anything other than a focus on patients and families and communities. That's what Building Alberta is all about, and that's what we're doing, Mr. Speaker.